Clonal hematopoiesis, if you look carefully, is very common in older individuals. At least 50% probably of those over the age of 70. If you look with more sensitive methods, it may be close to 100%. And we know that a small fraction of those persons is going to progress to a myeloid malignancy, MDS or AML. And so obviously the question is, how can we identify those persons who are really at risk of disease progression? Maybe just to cytopenia or to a overt myeloid malignancy. And we've actually seen very interesting data on that published just a couple of weeks ago by Dr. Weeks, who have shown that you can identify risk factors and build a clonal hematopoiesis risk score. This takes into account the specific gene that is mutated, the size of the clone measured by the allele frequency, but also hematologic abnormalities in terms of cytopenias, abnormal blood counts, red cell volume, and other parameters. And from that, you can calculate a score and risk stratify your CHIP patients. And what this shows us actually is that 90% of persons with clonal hematopoiesis, and probably even more, have very low risk disease. That means a 10-year risk of progression to a myeloid malignancy of less than 1%. And so these 90% of clonal hematopoiesis patients probably do not need any specific follow-up or monitoring. Then you have an intermediate risk cohort, which makes up about 10% of patients. And really only just 1% of persons with clonal hematopoiesis have high-risk disease, but those have a 50% risk of progressing to a myeloid malignancy over 10 years. And of course, those are the patients that we really would love to identify early in the future to be able to potentially also intervene. How can we do that? I mean, maybe at one point we will just do universal screening by sequencing, just as we do screening for other malignant disorders. I personally do not see this coming soon because, as I just said, in most patients, even if we find a clone, it's not going to have huge clinical relevance. So there are other approaches that are being tested. For example, you can look at blood counts that are taken during your usual checkup at your family physician. And you can potentially follow them up over like several years. And you can use AI or machine learning approaches to detect trends in how these blood counts or certain parameters may change over time. And maybe by that you can generate a signal and identify persons who then would get sequencing, and by that we can identify persons with high-risk clonal hematopoiesis. This is all fiction at the moment, but I think it's a very interesting perspective for the future, how we can pick up these individuals that are at risk of getting a myeloid disease.